Alright, before we dive into this crazy story, do me a favor, subscribe and tell us where you're watching from. The emergency department at Memorial Ridge Trauma Center felt different after midnight. Not quieter, just thinner. The waiting room lights had been dimmed. Conversations dropped to lower voices. The fluorescent glow over the trauma floor made everything look pale and exhausted. Ava Mercer stepped through the staff entrance at 12:41 a.m. The shift had technically started 11 minutes earlier, but Ava had arrived 30 minutes before that, the way she always did. Not because anyone expected it, because probation made every minute feel like an evaluation. Her badge still carried the thin red stripe beneath her name. Temporary trauma rotation. Under review. The label followed her everywhere she went in the ER. She moved through the locker room quickly and clipped the badge to her scrubs before stepping onto the trauma floor. No one greeted her. The charge nurse stood at the whiteboard assigning patient loads for the night shift. When she noticed Ava approaching, the pen paused for half a second. Mercer. Ava stepped closer. You're staying on low acuity beds tonight. Ava nodded once. Low acuity meant minor injuries, medication monitoring, and supply work. It meant the work that kept the department running but never placed her near the center of a trauma case. Across the room, 2 residents reviewed CT scans at the imaging station. Their voices carried easily across the floor. That her? One asked quietly. The other glanced toward Ava. Yeah. He lowered his voice slightly, but not enough to hide the words. She moves like she's waiting for permission to breathe. A few nearby staff smiled faintly. The charge nurse finished writing assignments. Stay available for supply checks, she said without looking up again. And don't crowd the trauma bay if something serious comes in. Understood, Ava answered. Her voice stayed soft. Not timid. Just controlled. The charge nurse glanced toward her briefly. Confidence matters in trauma, she added. Ava nodded. I know. But the conversation had already ended. Across the room, a nurse wheeled an equipment cart toward the supply wall. A resident snapped gloves onto his hands while explaining something loudly about triage protocol. The louder personalities always filled the center of the room. Ava moved in the opposite direction. The airway cart beside Trauma Bay 2 had been opened earlier in the evening. The drawer sat half closed. She pulled it open and checked the contents. Laryngoscope blades. Battery charge. Tube sizes aligned in their trays. The oxygen tubing had twisted around the handle during the last use. Ava untangled it and reseated the equipment carefully before sealing the drawer again. Behind her, one of the residents glanced over. You know respiratory checks those cards already, right? Ava logged the new seal number on the clipboard. Sometimes. He leaned against the counter watching her. You double-check everything. Ava closed the drawer. Most things. The resident smirked. That hesitation's going to get someone killed in trauma. She didn't respond. Instead, she stepped toward the medication station. One of the nurses there prepared an 4-dose for a patient recovering from surgery. The syringe lay ready beside a small vial. Ava slowed as she passed. Something about the label didn't match the dosage displayed on the computer. She leaned slightly closer. I think that's the concentrated vial, she said quietly. The nurse glanced down. Her expression changed immediately. Damn. She discarded the syringe and reached for the correct vial. Thanks. Ava nodded once and continued walking. No announcement. No explanation. The patient would receive a correct dose and never know how close the mistake had been. Across the hallway, a security guard stood near the ambulance bay doors, sipping coffee from a paper cup. He watched Ava checking the supply board and laughed lightly. You look nervous every night. Ava glanced toward him. Just focused. He grinned. Hope you never get stuck with a violent patient." She raised an eyebrow slightly. "Why?" "You'd fold in 5 seconds." The guard chuckled and took another sip of coffee. Ava didn't answer. She returned to checking the blood refrigerator inventory. O-negative units aligned in the rack. Expiration dates matched the log sheet. Her handwriting remained neat even at the end of a long shift. Across the trauma floor, the overhead radio crackled suddenly. Every head turned toward the speaker. "Stand by for trauma alert." The charge nurse stepped toward the center of the room immediately. "Trauma team to Bay 1." Staff began moving quickly. Ventilators rolled into position. Gloves snapped on. A stretcher was pulled toward the bay entrance. Ava closed the blood refrigerator door and stepped aside to give the team space. The dispatcher's voice returned through the speaker. "Priority inbound. Male patient. Severe trauma. Military background. Patient unstable and exhibiting combative behavior during transport." The phrase shifted the entire atmosphere of the ER. Military patient. Combative. Security presence. The guard near the ambulance door straightened. "Well," he said, glancing toward Ava with a half smile, "guess we'll see how steady those hands really are." Ava didn't respond. She stood near the equipment cart, watching the trauma team prepare the room. The monitors. The airway tray. The blood units waiting beside the bed. From the outside, she looked exactly the same as she had all night. Quiet. Unnoticed. The new nurse nobody trusted. But her eyes moved slowly across the room, studying every angle of the trauma bay before the ambulance even arrived. And somewhere in the rain outside, a wounded man was already on his way toward the one room in the hospital where Ava Mercer had been told she did not belong. The ambulance doors slammed open hard enough to echo through the emergency bay. Cold winter rain blew inside for a moment as the paramedics forced the stretcher through the entrance. The trauma team waiting in Bay 1 snapped instantly into motion. "Male, late 30s, the lead paramedic called out over the noise. Severe trauma, possible thoracic injury. Blood loss during transport." The wheels of the stretcher rattled over the floor as they crossed into the trauma room. But the patient on the stretcher did something no one expected. He pushed himself upright. Not smoothly, not fully, but enough that the straps holding him down stretched tight across his chest. "Sir, stay down," the paramedic warned. The man ignored him. He swung one leg toward the side of the stretcher as if trying to stand. The movement sent a ripple through the trauma team. "He shouldn't be moving," one resident muttered. The patient was bleeding heavily from a wound along the right side of his torso. The gauze packed against the injury had already soaked through. His clothing had been cut open during transport, leaving dark streaks of blood along the metal rails of the gurney. But the injury had not slowed him down the way the doctors expected. His eyes were wide, focused, not confused in the way ordinary trauma patients often were. Hyper-alert, the kind of awareness that came from adrenaline pushing the body beyond its limits. "Sir," the paramedic tried again, placing a hand on his shoulder. "You need to lie back." The man grabbed the paramedic's wrist before he could finish the sentence. Not violently, but with a grip strong enough to stop the movement instantly. "Don't touch me." The voice came out low and sharp. The room shifted immediately. Security, standing near the doorway, straightened. One of the residents stepped back. The man's eyes moved across the trauma bay, measuring the space. Lights. Hands. Equipment. Too many people. His breathing had become fast and shallow. Not panic. Survival. The kind of breathing pattern soldiers developed when the body shifted fully into combat mode. Army Ranger, the paramedic added quickly to the team. Found outside a military training area. Refused sedation. The phrase changed the atmosphere. Army Ranger. The words carried weight even in a civilian hospital. Dr. Carver, the trauma attending, stepped forward. "Sir, you're injured," he said firmly. "We are here to treat you." The ranger's head turned slowly toward him. Blood streaked along his jaw where a small cut had split open during transport. "I'm fine." The words were automatic. Instinct. The response of someone trained never to admit weakness. But his breathing betrayed him. Too fast. Too tight. Ava stood near the equipment cart where she had been placed earlier. From the edge of the room, she watched the man's posture instead of his wound. His shoulders remained raised, muscles coiled under the strain of adrenaline. His eyes kept moving, scanning the positions of the people around him. Looking for exits. Looking for threats. The trauma team saw something else. An aggressive patient. "I'm cooperative." Potentially dangerous. "Security," one of the nurses said quietly. Two guards stepped forward immediately. That was the wrong move. The ranger's eyes snapped toward them. His body shifted on the stretcher, ready to move again. "Back up," he warned. Security did not. One guard reached toward the bed rail. The ranger reacted instantly. His arm shot forward and knocked the hand away with surprising force. The movement sent the four-line swinging and nearly pulled the oxygen tubing loose. "Sir." The resident snapped. "You're going to make this worse." The ranger's breathing accelerated further. He swung his legs toward the side of the stretcher again. The room exploded into motion. "Hold him. Watch the line. Get restraints." Hands reached toward him from 3 different directions. Every touch made the situation worse. The ranger's body twisted away from them, trying to break free of the tightening circle. His breathing had turned sharp now, each inhale cut short by pain in his ribs. The trauma team read the scene as escalating violence. Ava saw something different. She watched the angle of his shoulders, the tightness in his neck, the way his eyes kept moving toward the door. Not attacking. Escaping. Pain. Shock. Adrenaline still flooding through a nervous system trained to react to threats instantly. The more people crowded him, the worse it became. Dr. Carver raised his voice. "Restrain him." Security moved closer. The ranger's breathing broke into a harsh rhythm as he tried to rise again despite the blood loss. The room had already decided what he was. A problem. A danger. Ava looked at him carefully. Not at the shouting. Not at the chaos. At the way his eyes flicked from face to face. At the shallow breathing that never fully filled his lungs. At the tremor in his hands that had nothing to do with anger. She understood something the rest of the room had missed. This was not random aggression. This was a wounded body locked in tactical overactivation. Pain. Shock. Adrenaline. All colliding inside a nervous system that had spent years learning to survive violence. And right now the trauma team surrounding him looked exactly like the kind of threat that training had prepared him to fight. If the room pushed any harder, the situation would explode. And Ava Mercer knew the difference between a violent patient and a soldier whose body had not yet realized the battlefield was over. The trauma bay had crossed the line between urgency and panic. The ranger still sat half upright on the stretcher, blood soaking the gauze pressed against his ribs. His breathing came in short bursts through clenched teeth. The oxygen mask hung crooked near his shoulder where it had been knocked loose during the struggle. Security stood closer now. Too close. One guard had moved near the foot of the bed while the other drifted toward the patient's left side, trying to block escape routes the way they would with a violent detainee. But the ranger's eyes tracked every movement. Not with rage. With calculation. His breathing grew sharper each time someone shifted position. Dr. Carver stepped forward. We're sedating him. The decision came quickly. Too quickly. A resident grabbed a syringe from the medication tray and began drawing from a vial. No one had secured the airway. No one had stabilized the fall line. The room simply wanted control. "Give it now," Carver said. The resident nodded and stepped toward the stretcher. The ranger's head turned instantly. His shoulders tightened again. The syringe glinted under the fluorescent light. His eyes locked onto it. "What's that?" he demanded. "It's for pain," the resident said quickly. But his voice had the wrong tone. Authority instead of reassurance. The ranger's breathing spiked. "Stay back." The resident ignored him and moved closer. Security shifted at the same moment. 3 people closing distance at once. The ranger's body reacted before the rational part of his mind could catch up. He swung his arm toward the approaching hand. The syringe flew sideways. It struck the metal rail of the stretcher and bounced across the floor. "Damn it!" the resident snapped. The movement sent a ripple of alarm through the room. A nurse standing near the supply cart fumbled the tray she was holding. Metal instruments scattered across the tile floor. The sound was loud, sharp, sudden. The ranger flinched violently at the noise. His breathing broke into harsh, uneven bursts. The trauma bay had lost control of the moment completely. Security stepped forward again. "Grab him." That was the worst possible instruction. The ranger's eyes widened. For a fraction of a second, his body shifted into something older than pain. Training. Reflex. He twisted against the stretcher straps, muscles tightening despite the blood loss. The entire trauma team reacted at once. More hands. More shouting. More movement. Fear had taken over the room. And fear made people stupid. Ava watched from the edge of the equipment cart. She didn't raise her voice. She didn't step dramatically into the center of the chaos. Instead, she began moving quietly. First, she reached toward the tray of instruments that had spilled onto the floor. She slid the scalpel and needle driver farther back beneath the counter with her foot. Out of reach. Then she stepped closer to the nurse who had dropped the tray. "Back up," Ava said softly. The nurse blinked, still startled. "Just step behind the cart." The woman obeyed automatically. Ava turned slightly and nudged the oxygen cylinder away from the stretcher rail where it could be knocked loose during another struggle. None of the adjustments looked important, but each one removed something dangerous from the immediate reach of the patient. Across the bed, the resident had retrieved another syringe. "Hold him still." Security moved again. The ranger's breathing had become ragged now. Every muscle in his body braced for another fight. Ava knew exactly what would happen next. They would restrain him, sedate him badly, and in the process someone would get hurt. Possibly the patient himself. She felt the pressure of the decision settle quietly in her chest. She could stay silent. Follow the chain of command. Let the attending run the room the way he believed was correct. If it went wrong, the responsibility would belong to someone else. Or she could step in, interrupt, and risk becoming the nurse who challenged authority in the middle of a trauma case. Ava inhaled once, then spoke. "Doctor." Her voice was not loud, but it cut through the shouting because it was calm. Dr. Carver turned toward her with irritation already forming in his expression. "What?" Ava kept her tone respectful. Everyone moving closer at once is escalating his threat response. Carver frowned. This isn't a discussion. She didn't argue. She simply continued. His breathing is getting worse. Carver's jaw tightened. We are aware of that. Ava gestured toward the ranger's shoulders. He thinks he's being surrounded. The resident scoffed. He is being surrounded. Ava held Carver's gaze. If you step back 2 feet and give him space, he may stop fighting. The suggestion hung in the air for half a second. Carver's expression hardened immediately. This is not your call. Ava nodded. Yes, Doctor. Then stop interfering. His voice carried across the room now. Your support staff tonight. The room had gone quiet again. The ranger's breathing still rasped under the fluorescent lights. Carver pointed toward the supply wall. If I need advice, I will ask for it. Ava stepped back without another word. The interruption had lasted less than 10 seconds. But the warning behind his tone was clear. Do not interfere again. The moment after Dr. Carver's warning did not calm the room. If anything, the tension thickened. The ranger had twisted far enough against the stretcher that one of the side rails bent slightly under the strain. Blood from the wound along his ribs had begun to seep through the gauze again, running down across his side and dripping slowly onto the white sheet beneath him. His breathing had become sharp and shallow. Not only from pain, from the pressure of the room closing in. Security had moved again after Ava stepped back. One guard positioned himself near the wall behind the stretcher, trying to block a possible exit route. The other stood near the patient's shoulder, waiting for the signal to restrain him. But the movement had the opposite effect. The ranger's eyes followed them both. He shifted again, trying to move away from the cluster of bodies surrounding him. The stretcher wheels hit the wall with a dull metal thud. Now he was trapped between the equipment rack and the wall of the trauma bay. The realization hit him instantly. His shoulders tensed harder. His breathing turned rougher. Don't touch me, he said again, his voice lower now but more dangerous. Dr. Carver gestured sharply. Take him down. Security stepped forward together. The ranger reacted with the kind of speed that came from instinct rather than strength. He shoved the stretcher sideways. The wheels screeched across the floor. One of the monitors nearly tipped over. A nurse jumped back with a startled gasp. The ranger had backed himself fully into the corner of the trauma bay now, pressed between the wall and the metal frame of the bed. Blood streaked along the floor beneath him. His chest rose and fell too quickly. His eyes darted across the room again, not looking for escape anymore, looking for the first person who might reach him. Everyone in the trauma bay looked like a threat. Security, doctors, bright lights, too many voices, too much movement. The resident stepped forward again, trying to regain control. Sir, you need to calm down. The words had no effect. The ranger's breathing only worsened. Ava watched from the supply wall. She saw something the others did not. The ranger had reached the edge of what his body could tolerate. Pain, blood loss, adrenaline, and now fear. If someone grabbed him now, the situation would explode completely. Ava stepped away from the wall. No one noticed immediately. The room's attention remained fixed on the ranger. She approached slowly, not toward the center of the group, toward the open side of the stretcher where no one else was standing. Her hands stayed visible, empty. She moved carefully, each step deliberate and quiet. No sudden motion, no raised voice. When she reached the edge of the bed, the ranger's eyes snapped toward her. His breathing still came in harsh bursts, but his attention shifted. He had not seen her approach. Ava stopped 2 steps away. She lowered her voice slightly, not soft, controlled, the kind of tone that carried through noise without becoming louder. Look at me. The words were simple, but the way she said them was different from anything that had been spoken in the room. Not pleading, not explaining. A command. The ranger's eyes locked onto hers. For a moment, the tension in his shoulders remained. Then something changed. He heard the cadence, the structure of the sentence. Not nursing language, not civilian reassurance. Something closer to triage control. The kind of voice used when lives depended on immediate compliance. Ava didn't move any closer. She kept her hands where he could see them. Breathe. One word. Sharp. Measured. The ranger's chest still heaved with adrenaline, but his attention stayed on her. The room behind Ava had gone completely quiet. No one had expected the nurse who had been scolded seconds earlier to step forward again. Dr. Carver opened his mouth to interrupt, but he stopped, because something impossible had just happened. The ranger stopped moving, not completely calm, not healed, but for one single second his body froze in place. His breathing slowed just slightly. One breath, then another. Ava used the moment immediately. Without turning around, she spoke over her shoulder. "Everyone take 2 steps back." Her tone remained calm, but it carried the same command. Security hesitated. A resident looked toward Dr. Carver. Ava did not repeat herself. She simply kept her eyes on the ranger. The pause stretched. Then the anesthesiology nurse quietly stepped back first. Security followed a moment later. The space around the stretcher widened. The ranger's breathing steadied another fraction. Ava watched the change carefully. "Good," she said quietly. Her voice stayed low. "Stay there." The ranger's shoulders loosened just enough that the tension began to drain from his posture. Across the trauma bay, Dr. Carver stood completely still. The realization had arrived too late. The nurse he had dismissed seconds earlier had just done something the entire trauma team had failed to accomplish. She had control of the patient. And suddenly, the loudest voices in the room were no longer the ones directing it. The moment the ranger's breathing slowed, Ava knew the window would not last long. Pain still lived inside his ribs. Blood still soaked the gauze along his side. Adrenaline still ran through his body like electricity waiting for the next threat. If the room slipped back into panic, the fragile calm would vanish instantly. Ava kept her eyes on him, not staring, watching, measuring. The ranger's shoulders were still tight, but no longer coiled to strike. His breathing had slowed just enough to think. That was the moment she needed. Without turning away from him, Ava spoke. "Pressure stays where it is." Her voice carried clearly across the trauma bay. One of the nurses who had been holding the wound pack nodded and adjusted her grip. "Line prep." Another nurse moved toward the IV cart automatically. "A second unit ready." The words came in a steady rhythm. Not fast, not loud, but precise. The room began to reorganize around the instructions without the frantic noise that had filled it moments earlier. "Airway backup on the right." The respiratory therapist stepped closer to the head of the bed. "Left side clear." Security and one of the residents shifted backward, creating a clean working space beside the stretcher. No one had formally handed Ava control, but the room had already accepted the change, because panic had failed them, and calm had worked. Ava's focus returned to the ranger. His eyes still watched every movement in the room, but now they returned to her face between each glance. He was orienting to her voice. That mattered. She spoke again, quieter this time. "Stay where you are." The words were not a request. They were a boundary. The ranger gave the smallest nod, not agreement, but acknowledgement. Ava studied the wound pack against his ribs. Blood still seeped around the edges, but the pattern of the bleeding told her something important. Everyone else in the room had focused on the obvious injury, the open wound along the side of his torso. But that wasn't the immediate threat. The darker flow coming through the gauze told a different story. Pressure inside the chest. Internal bleeding building where no one could see it yet. If it worsened, his breathing would collapse long before the external wound killed him. Ava glanced toward the monitoring screen. Heart rate high, blood pressure dropping slowly. Not catastrophic yet, but moving in the wrong direction. She kept her voice steady. "Prepare chest access." The respiratory therapist looked up. "You think it's building inside?" "Yes." Ava didn't explain further. She didn't need to. The pattern was there for anyone trained to see it. Across the bed, the ranger watched her carefully. His breathing had steadied enough that his words came clearer now. "Not capture?" The sentence came out rough, cut by pain, but the meaning was clear. He was still reading the room as a potential threat. Ava shook her head once. "No one's taking you anywhere." Her tone stayed calm, clinical. But the language shifted just slightly. She wasn't speaking like a nurse addressing a patient. She was speaking like someone managing a wounded operator. "You're safe here." The ranger's shoulders lowered another fraction. Across the room, the charge nurse stepped closer to Ava, not announcing the movement, simply adjusting position to assist. The medic who had transported the ranger followed the same pattern, Both of them watched Ava now when waiting for the next instruction, not the doctor's. A resident noticed the shift. His expression tightened. "You can't just start running the room," he said sharply. The words landed harder than the tone. The ranger's head turned immediately toward the sound. His breathing began to accelerate again. The fragile calm cracked at the edges. Ava reacted instantly. She lifted one hand slightly, not toward the ranger, but toward the resident. "Stop!" The word came out calm but firm. The resident froze. Ava didn't look at him. She kept her attention on the patient. "Lower your voice." The resident bristled. "You're not in charge here." Ava finally turned her head. Her expression stayed neutral. "I know." No challenge, no confrontation, just truth. Then she looked back to the ranger before the tension could grow further. "Focus on breathing." Her tone softened just slightly. "In through your nose." The ranger followed the instruction automatically. Ava used the moment to redirect the room. "Second unit ready?" "Yes," the nurse answered. "Good." She nodded once. "Hold pressure steady." Then she added quietly, without accusation or authority, "We fix him first." The words shifted the energy in the room again. Not a command, a reminder. Even the resident hesitated after that, because no one could argue with the priority she had just set. Save the patient. Everything else came after, and Ava Mercer managed the fragile balance of the trauma bay without humiliating anyone, even the people who had doubted her moments earlier. The ranger remained still on the stretcher, watching her, breathing, alive. For now. For a moment, the room believed the worst had passed. The ranger's breathing had slowed. His shoulders no longer strained against the stretcher. The frantic movements that had filled the trauma bay earlier had faded into careful, measured steps. To most of the team, the shift looked like progress. But Ava Mercer knew better. Shock did not calm itself. Blood loss did not pause out of courtesy. If the patient suddenly appeared weaker, quieter, slower, it usually meant the body was losing the fight. She studied the ranger's breathing again. Each inhale lifted the right side of his chest slightly later than the left. A delay. Small, but wrong. The wound along his ribs continued to seep through the dressing, though not violently enough to alarm the room. The monitors showed a steady decline in blood pressure. Not crashing, not stable. Sliding. Ava leaned closer to the edge of the bed, careful not to invade the ranger's space too quickly. His eyes opened halfway, still alert, still watching, but the strength behind the gaze had begun to dim. "Stay with me," she said quietly. He gave a faint nod. Across the room, Dr. Carver misread the moment completely. "He's tiring out," the attending said. "Good. Get him flat so we can move." Two staff members stepped toward the stretcher rails. The plan was simple. Lay him fully down. Secure the lines. Prepare for transfer. But the motion came too fast. Ava saw it immediately. If they forced him flat now, pressure inside the injured side of his chest would spike instantly. The internal bleed she suspected would worsen, possibly fatally. "Wait." The word came out calm, but sharp enough to stop the movement. Carver turned toward her with visible irritation. "We're not debating this again." Ava shook her head slightly. "Don't lay him flat yet." The resident frowned. "Why not?" Ava gestured toward the ranger's chest. "Pressure inside the right side is building." Carver crossed his arms. "You're guessing." Ava didn't argue. She pointed toward the monitor. Blood pressure falling. Then toward the patient's ribs. Breathing lag on the right side. The room hesitated. The ranger shifted slightly on the stretcher. Pain flashed across his face. Carver made the decision anyway. "Lower him." The two staff members began to push the stretcher down. Ava stepped forward, not aggressively, but directly into their path. "Stop!" The word landed with the same calm authority she had used earlier. Carver's patience snapped. "You do not override orders in my trauma bay." The words carried through the room. Several people looked away, but Ava didn't move. "If you drop him flat," she said evenly, "the pressure will spike." Carver stared at her. "You're speculating." Ava held the ranger's gaze again. His breathing had grown weaker, but he was still listening, still aware. She made the decision quietly. "Give me 30 seconds." Carver scoffed. "This isn't your call." But the medic who had transported the ranger spoke first. "She's not wrong about the breathing." The charge nurse glanced at the monitor again. Pressure's dropping faster. The room wavered. Just enough. Carver exhaled sharply. 30 seconds. Ava nodded once. She turned back to the ranger. "I need to check the wound." His eyes narrowed slightly. Pain had stripped away much of his earlier aggression, but trust had not replaced it yet. Ava kept her hands visible, slow, controlled. "I'm not moving you," she said. "Just looking." The ranger studied her for a moment. Then he gave the smallest possible nod. Permission. Ava carefully lifted the outer gauze from the wound. The blood underneath told the story immediately. Not just an external injury. Air pressure building beneath the ribs. A slow collapse beginning inside the chest. A tension complication forming beneath the obvious trauma. If they had forced him flat, the condition would have worsened instantly. She replaced the gauze and looked toward the respiratory therapist. "Needle decompression tray." The therapist froze. Carver's expression hardened again. "You're diagnosing a tension complication from across the room?" Ava didn't raise her voice. "From the breathing pattern." She pointed again. "Lag on the right side." The therapist moved first. The tray appeared beside the bed. Carver shook his head but did not stop them. Ava spoke again, calmly guiding the sequence. "Pressure steady. Line secure. Stay upright." Each instruction came in the same quiet rhythm that had already stabilized the room once. The ranger watched her closely now. When she stepped closer to his side, he didn't pull away, didn't tense, didn't fight. For the first time since arriving, he allowed someone close enough to treat the wound properly. Ava positioned the needle with steady hands. Field experience translated carefully into the civilian setting around her. She paused once, measured the space, then completed the stabilization maneuver with disciplined precision. A faint rush of air escaped. The ranger's chest lifted slightly deeper on the next breath. Across the trauma bay, the shift in the monitors told the rest of the story. The complication had been real, and the nurse the team kept arguing with had just prevented it from becoming fatal. The change in the ranger's breathing was small, but everyone in the room noticed it. Before the needle decompression, each breath had been shallow and uneven. The right side of his chest had lagged behind the left, struggling against the pressure building inside. Now the air moved more freely. Still painful, still fragile, but no longer collapsing. The monitors reflected the shift a few seconds later. His oxygen levels steadied. The slow drop in blood pressure paused for the first time since he had arrived. The room exhaled together. No one spoke the words out loud, but the meaning hung between them. The intervention had worked. Ava stepped back half a step, giving the respiratory therapist space to secure the line properly. Her hands remained steady, though she could feel the adrenaline in her chest beginning to fade. The ranger watched her the entire time. His eyes had lost the frantic edge they carried earlier. Pain still clouded them, but the alertness behind the gaze had sharpened. He was thinking now, not fighting, studying. Ava adjusted the gauze over the wound and checked the line pressure. Routine movements. Quiet, deliberate. But the ranger's attention never left her. When she reached to reposition the pressure dressing, her hand settled naturally against the lower edge of his ribs, just above the diaphragm, where the breathing muscles needed support during chest trauma. The placement was precise, too precise. It was the kind of adjustment that came from repetition under stress. The ranger's eyes narrowed slightly. "You've done this before." His voice came out rough, cut by pain, but the certainty behind the words carried weight. Ava didn't look up immediately. She finished securing the dressing. "Stay still," she said quietly. He ignored the instruction. "You're not new." The statement wasn't a question. Across the trauma bay, several members of the staff paused in their work. Not obviously, but the attention in the room shifted. They had already begun watching Ava differently after the last few minutes. Now the patient himself had noticed. Ava finally met the ranger's gaze. "Focus on breathing," she said calmly. "In through your nose." He held her eyes. "You recognized the pressure shift before anyone else." Ava didn't respond. "You moved the room like a team leader," he continued. Each word cost him effort, but he pushed through the pain. "And you knew exactly where to place that needle." The medic standing near the bed shifted slightly. The charge nurse glanced at Ava. The silence in the room grew heavier. The ranger studied her face carefully. Then he asked the question that landed too close to the part of Ava Mercer she had buried years ago. "Where did you learn that?" The words were simple, but the meaning behind them carried history. Ava felt the old tension stir quietly in the back of her mind. The smell of antiseptic in the trauma bay blended for a moment with memories she had spent years avoiding. Field tents, helicopter rotors, night operations lit by red headlamps instead of fluorescent lights. She pushed the thoughts away. This was not the place for them. And the people in this room did not need that story. Ava kept her voice level. "You're losing blood." The ranger's eyes stayed on her. That wasn't an answer. "No," she said. "It wasn't." She adjusted the IV line again. "Right now you need to stay conscious." The ranger studied her for another second. Then something shifted in his expression. Not suspicion, recognition, not complete, but enough. He had heard the tone in her voice earlier, the cadence, the way she issued instructions without hesitation. And now, the way she moved during treatment confirmed it. This nurse was not working from textbooks. Ava felt the attention in the trauma bay growing. Doctors, nurses, security, all of them watching the interaction more carefully now. None of them understood the full picture, but they had begun to realize the rookie nurse they had dismissed earlier carried experience none of them expected. The ranger's breathing slowed again. He spoke quietly this time. "Medic?" The word hung between them. Ava didn't react outwardly, but the question settled heavily in her chest. Answering it directly would open a door she had kept closed for years. Refusing it entirely might break the fragile trust she had built with him. She chose the narrow path between both options. "Right now," she said calmly, "I'm your nurse." The ranger held her gaze. Then he gave the smallest nod. It was enough. Across the trauma bay, the staff continued their work, but the atmosphere had changed. They watched Ava Mercer now with quiet attention, not because they knew her history, but because they had finally understood something simple. The quiet nurse they had dismissed earlier was the one person in the room who had kept their patient alive. And Ava realized something else at the same time. If she wanted the ranger to survive the next stage of treatment, she would have to keep stepping forward. Which meant the part of herself she had tried to keep invisible was no longer going to stay hidden. The quiet that followed the recognition did not last long. Ava had barely stepped back from the wound when the monitors shifted again. At first the change looked small. The ranger's heart rate, which had been holding steady after the decompression, suddenly climbed. The numbers on the screen jumped 10 beats, then another 10. His breathing tightened. The oxygen line on the monitor dipped. Not dramatically, but enough that Ava felt the warning instantly. The internal bleeding had not stopped. It had only paused. She looked down at the ranger's face. His eyes were still open, still tracking the room, but the focus behind them had begun to blur slightly. His skin had turned paler under the fluorescent lights. The charge nurse noticed the change next. Pressures dropping again. The numbers confirmed it. Blood pressure sliding downward. Oxygen drifting. The brief stability was gone. Dr. Carver stepped closer to the monitor. "What happened?" No one answered. Because the answer had already arrived in Ava's mind. The chest pressure had been part of the problem, but not all of it. The bleeding inside his abdomen was worsening now that circulation had resumed. A slower collapse, but just as deadly. The ranger's breathing hitched suddenly as pain surged through his side. His hand tightened on the edge of the stretcher. The tension returned to the room immediately. Residents began speaking over one another. "We need imaging." "No time." "Prep for transfer." "Pressure's falling too fast." The room began to fragment again. Ava didn't raise her voice. She stepped closer to the bed. "Blood now!" The instruction landed clearly. The nurse already holding the prepared unit moved instantly. "Second line open," Ava added. The medic adjusted the tubing. Dr. Carver turned toward her again, frustration rising. "We need to move him upstairs." "If we move him now, he'll crash on the elevator," Ava said calmly. Carver's jaw tightened. "You're guessing again." Ava shook her head slightly. "Look at the pressure drop." She pointed toward the monitor. Internal bleed accelerating. The ranger shifted weakly on the stretcher. His breathing had become uneven again. Ava placed one hand lightly against his shoulder. "Stay with me." His eyes opened again. He nodded faintly. Ava turned back to the room. Her voice remained steady. "Prepare abdominal compression." The resident blinked. "That's not standard here. It will buy us time." Carver hesitated. The room hung between two choices: his authority or the patient's survival. The ranger's pressure dropped again. The monitor alarm chirped sharply. Carver looked at the numbers, then at Ava. The decision arrived reluctantly. "Do it." The tension in the room shifted immediately. Ava moved into position beside the stretcher. Her hands were steady now, completely still. The earlier tremor was gone, because the moment had become simple. Life or death. She spoke quietly as she worked. "Pressure here." The charge nurse followed the instruction. "Keep the line open." The medic adjusted the flow. Ava studied the ranger's breathing again. Each inhale grew shallower. The next collapse was coming. She could feel it before the monitors showed it. "Get ready," she said. The respiratory therapist looked up. "For what?" "Airway support." 2 seconds later, the oxygen alarm dipped again. The therapist moved immediately. Across the room, one of the residents stared at the monitor. "How did you know that was coming?" Ava didn't answer. Her attention remained on the ranger. The compression maneuver required precise pressure and timing. Too much force would worsen the bleeding. Too little would do nothing. She adjusted her position slightly, then completed the stabilization sequence. The effect appeared slowly. First the bleeding slowed. Then the oxygen level steadied. Finally, the blood pressure stopped falling. Not stable, but no longer collapsing. The room grew quiet again. Everyone watched the monitors, waiting for the next drop. It didn't come. Dr. Carver exhaled slowly. The ranger's breathing eased slightly. His eyes opened again. He looked directly at Ava. The fear that had filled his expression earlier was gone. Not because the pain had disappeared, but because he had made a decision. Trust. His hand released the edge of the stretcher. His shoulders settled against the bed. For the first time since arriving in the trauma bay, the Army Ranger stopped fighting completely. Not because his strength had run out, because he had chosen the one person in the room he believed would keep him alive. And the rest of the trauma team followed Ava Mercer's quiet rhythm because it was the only thing holding the room together. The monitors held steady. Not strong, not safe, but stable enough that the alarm stopped screaming. For the first time since the Ranger had arrived in the trauma bay, the room no longer felt like it was collapsing around him. Ava kept one hand near the compression point for a few seconds longer, watching the numbers carefully. Blood pressure low but holding. Oxygen levels fragile but climbing. Heart rate still fast, though no longer racing toward collapse. The immediate danger had passed. Only the immediate danger. Ava stepped back slowly and let the charge nurse take over the pressure hold. "Maintain that position," she said quietly. The nurse nodded. Across the room, the anesthesiology team began preparing the equipment for transfer. The surgical team had already been notified. The Ranger would need definitive care in the operating room. But now he had time to reach it. That was the victory. And it was a small one. The trauma bay had fallen into a strange silence. No shouting. No hurried orders. Just the soft hum of the monitors and the distant sound of rain against the ambulance bay doors. People moved carefully now, almost cautiously. The residents who had argued earlier focused on securing the 4 lines. The respiratory therapist adjusted the oxygen mask with gentle precision. Security stood back near the doorway, no longer crowding the bed. The shift in the room was obvious. Earlier, the Ranger had been treated as a threat. A problem. Something to control. Now everyone could see the truth. Fear had nearly killed him. Not the wound. Not the blood loss. The chaos of the room itself. Ava wiped her hands on a fresh cloth and stepped away from the stretcher. The Ranger's eyes followed her. He looked weaker now. The adrenaline had burned away, leaving exhaustion behind. But his focus remained clear. Across the trauma bay, Dr. Carver stood near the monitor with his arms folded. His posture had changed. The tension in his shoulders was gone, replaced by something quieter. Recognition. He watched Ava for a moment as she moved back toward the supply cart. Then he looked down at the chart in his hand. Not speaking. Not apologizing. Just understanding what had happened in his trauma room. The residents had noticed it too. They spoke less now. Worked more carefully. Each of them occasionally glanced toward Ava before continuing their tasks. No one asked questions. No one said the obvious thought out loud. But the realization lived in the room. The quiet nurse they had dismissed earlier had been the most experienced trauma mind standing beside that bed. Ava kept her attention on routine work. She checked the foretubing, adjusted the bloodline, secured the gauze along the Ranger's ribs again. Nothing dramatic. Nothing that suggested she had done anything unusual. Because drawing attention now would only reopen the tension she had just contained. Across the room, the surgical transport team arrived with a second stretcher. They prepared to move the Ranger carefully for the trip upstairs. The medic who had arrived with the patient stood near the wall watching Ava. His expression carried the same quiet understanding the Ranger had shown earlier. He had seen the way she moved. The decision she made under pressure. He didn't ask about it either. Some things did not need explanation. As the transport team positioned the new stretcher, the Ranger lifted his hand slightly from the bed. The movement was small. But Ava noticed. She stepped closer. "You're going to surgery," she said calmly. He nodded faintly. His voice came out rough. "You stayed." The words were simple, but the meaning behind them carried weight. Ava didn't answer immediately. She adjusted the oxygen mask instead. "You're not done yet," she said quietly. The Ranger watched her for a moment longer. Then he spoke again. Not loud. Just enough for her to hear. "Good medic." The phrase was brief. Professional. Not praise. Recognition. Ava felt something tighten quietly in her chest. The words pulled at memories she had worked hard to bury. Dusty field hospitals. Long nights under red lights. Men carried in from helicopters with wounds worse than this one. She pushed the thoughts away. Now was not the time. She gave the Ranger a small nod. "Stay alive," she said simply. The transport team began rolling the stretcher toward the doors. As they moved him out of the trauma bay, the room remained silent. No applause. No celebration. Only the quiet understanding that a life had almost been lost inside that room. And that the person who had kept it from happening had never asked for credit. When the doors closed behind the stretcher, Ava finally allowed herself to lean slightly against the counter. For the first time all night, the steadiness left her hands. Just for a moment. Just long enough for the memories she had buried to press against the edges of her thoughts again. Then she straightened. Because the emergency room never stayed quiet for long. By the time the surgical doors closed upstairs, the night in the emergency department had already begun to shift. The rain outside had slowed to a softer rhythm against the ambulance bay windows. The darkness that had pressed against the hospital all night had begun to thin at the edges. Faint grey light crept slowly across the parking lot and into the high glass panels above the ER entrance. Inside, the fluorescent light still hummed with the same cold brightness they had carried through the night. But the tension had drained out of the room. The trauma bay where the ranger had nearly died looked ordinary again. Cleaned surfaces. Fresh linens. The monitors reset for the next patient. If someone walked in now, they would never guess how close the room had come to breaking apart only an hour earlier. The night shift staff moved more quietly than usual. Part of it was exhaustion. Part of it was something else. The kind of silence that followed a moment people were still trying to understand. Rumors had already begun moving through the department. Short fragments of conversation carried through the hallway near the nurses' station. "Did you hear what happened in Bay 1? They said the patient almost took out security." "No, the nurse stabilized him before surgery." "Which nurse?" "I'm not sure." The details traveled quickly, but never completely. Every version of the story stopped just short of the full truth. Ava Mercer stood at the medication cart near the back wall, restocking supplies. She moved slowly and carefully, replacing items that had been used during the trauma. Fresh gauze. Sterile syringes. A new decompression kit. Nothing about the work looked unusual. To anyone watching from across the room, she appeared exactly the same as she had at the beginning of the shift. Quiet. Focused. Almost invisible. The charge nurse approached after a few minutes. She stopped beside the cart and watched Ava for a moment without speaking. Earlier in the night, her voice had carried a different tone. Skepticism. Concern about whether the quiet nurse could handle a trauma floor. Now the hesitation was gone. "You did well," the charge nurse said finally. The words were simple. Not dramatic. But they carried weight. Ava didn't look up right away. She finished placing the last tray into the cabinet before answering. "He was a strong patient," she said. The charge nurse gave a faint nod. "That wasn't what I meant." Ava met her eyes briefly. Neither of them expanded the conversation further. Some acknowledgements didn't need explanation. A few minutes later, Dr. Carver stepped out of the hallway leading to the operating elevators. He looked tired. The tension from earlier had faded, leaving only the quiet focus of someone replaying a difficult case in his mind. He stopped near the nurse's station when he saw Ava. For a moment it looked like he might say something formal. An apology. A question. But he didn't. Instead, he simply gave a small nod. Not authority. Respect. Then he continued down the hallway toward his office. The shift change had already begun. Day staff arrived with fresh coffee and clipped voices, glancing over the charts from the night. They noticed the quiet tone of the room but didn't yet understand why. A hospital administrator appeared briefly near the desk, reviewing the overnight reports. He paused when he saw Ava. "I'm told you handled yourself well during that trauma." Ava kept her attention on the chart in front of her. "We had a strong team." The administrator studied her for a moment. "You've been on a temporary rotation here, correct?" "Yes. There may be opportunities for a more permanent role." The words hung lightly in the air. A position with more visibility. More authority. More recognition. Ava closed the chart gently. "I'm comfortable where I am." The administrator looked mildly surprised. Most people would see that as a step forward. Ava nodded once. "I understand." But she also understood something else. Visibility came with questions. Attention. Expectations. And the past he had buried did not belong in the middle of a civilian hospital. The administrator eventually gave a polite smile and moved on. The emergency department continued its quiet transition into morning. Ava walked down the hallway toward one of the standard treatment bays where a patient had been waiting through the shift. An elderly man lay on the bed with an IV already placed in his arm. Nothing dramatic, just dehydration and fatigue. Ava checked the line carefully, adjusted the flow, pulled the blanket higher over his shoulders. The movements were calm, precise, the same steady hands that had controlled a collapsing trauma room only hours earlier. Outside the windows, the first thin line of sunrise touched the edge of the sky. Inside the hospital, the fluorescent lights still hummed with their quiet, indifferent glow. Ava finished adjusting before and stepped back. The patient slept peacefully. No one watching the hallway would know what had happened during the night. And Ava Mercer moved on to the next chart in the same calm silence, as if the moment that had revealed who she really was had never belonged to her at all.